Hello, my name is Alexandra Goldberg, and first I would like to acknowledge the opportunity to present to the World Health Organization Executive Board and my lecturer Judith McCool for this opportunity and support by guiding the preparation of the presentation to the board. Today I'm going to discuss why antimicrobial resistance should be included in 2020 World Health Assembly agenda. So what is antimicrobial resistance? Microorganisms such as bacteria, viruses, fungi, and parasites develop resistance to medicines naturally over time and are also known as superbugs. However, the overuse and misuse of antimicrobial drugs that is unfortunately practiced in many places around the world in humans, landbound and aquatic animals, plants, and crops has greatly accelerated its development and spread by changing the microbial DNA. The changes in DNA are encouraged because in people and animals, antibiotics are often given without professional oversight by uncontrolled over-the-counter sales, and people may buy and take antibiotics for treating viral infections like cold and flu. Then there is production of poor quality and falsified medicines, and also for promoting growth and prevent diseases in healthy animals to underinvest in veterinary services to save money. As a result, these medicines become ineffective and infections persist in the body, increasing the risk of spread to others and increase the risk of procedures such as organ transplantation, cancer chemotherapy, diabetes treatment, surgery, and childbirth. Why is antimicrobial resistance a global concern? Well, what has been alarming for the past few decades is that superbugs are developing resistance mechanisms very rapidly and are spreading globally. Today, antimicrobial resistance is present in every country and threatening our ability to treat common infectious diseases, resulting in prolonged illness, disability, and death. Data provided from more than a third of countries of all income levels to WHO in 2017 reported widespread resistance to common pathogens and alarming levels of antimicrobial resistance. Some OECD countries have about 35% of common human infections that are already resistant to currently available medicines, and low and middle income countries, especially in the Western Pacific region, have resistance rates as high as 80 to 90% to antibiotics. Resistant infections are already causing an estimated of at least 700,000 deaths every year, including 230,000 deaths from multi-drug resistant tuberculosis, and these have been projected to almost double by 2030. And by 2050, 2.4 million people could die in Europe, North America, and Australia. Inequitable and inadequate access in the Western Pacific region to already existing antimicrobial agents kills nearly 6 million people every year, including 1 million children who die of preventable sepsis and pneumonia. Without an urgent action, this could rise to 10 million people and deaths every year by 2050. The economic impact of antimicrobial resistance is already catastrophic, as the current cost for containing measures of antimicrobial resistance are around $9 billion annually. And by 2030, without intervention in place, this will force 24 million people, mainly in low-income countries, into extreme poverty. This could be referred to the annual economic damage and shocks experienced during 2008 and 9 global financial crisis. Only this would be as a result of antimicrobial resistance, but with no end in sight. But if investments are made now, this could be cost saving. For example, high-income and middle-income countries only need to invest $2 per person per year for an effective package of measures, and the benefits so great that investments are likely to pay for themselves. And in many countries of the Western Pacific region, investments would be a little higher, but still relatively modest, and are urgently needed. If this is delayed, catastrophic impact of uncontrolled antimicrobial resistance would be a lot more costly for the world and much harder to cope with in the future. To try and tackle this issue, the WHO has been supporting its member states by providing technical assistance to develop national action plans on antimicrobial resistance based on the Global Action Plan and strengthen their health and surveillance systems so they can manage the antimicrobial resistance. The WHO has been doing this for the following 5 initiatives to address antimicrobial resistance, but I would like to acknowledge there have been more initiatives, but I will only discuss 5 on our agenda. The first and the most important objective is the formation of Interagency Coordination Group of Antimicrobial Resistance, IACG, or known as tripartite agencies. The tripartite agencies consist of the WHO that is collaborating with the Food and Agricultural Organization of the United Nations, FAO, and the World Organization for Animal Health, OIE. It was established in 2010, but officially documents were signed in September 2016 by the request of the United Nations Secretary General to hold this tripartite agency accountable, improve coordination between international organizations, and to ensure effective global action against the threat to health security by antimicrobial resistance. It was a signal that represented a landmark for the world to take a broad and coordinated approach known as the One Health approach. The One Health approach addresses, commits, and tries to tackle the main causes of antimicrobial resistance, calling for greater urgency and action in response to its many challenges across multiple sectors, especially human health, animal health, and agriculture. To do this requires improvement of the implementation of the One Health National Action Plan at a first rate and make it at the heart of the global response to antimicrobial resistance, because currently it is done at a very slow pace. And strategy involves provision of additional strategic guidance, technical support, and resources that are necessary to make multisectoral antimicrobial resistance working groups functional and to help implement monitoring national action plans. Also, maintaining political buy-in on every country level for antimicrobial resistance is still a challenge in countries because broadening an interest in development allocating scarce national resources for tackling antimicrobial resistance is difficult. For this, the strategy would be to invest in a sustainable and complemented way by continuing advocacy. Initiative number 2 is the improvement of awareness and understanding of antimicrobial resistance through effective communication, education, and training. World Antibiotic Awareness Week has been happening every November since 2015 with the theme Antibiotics Handled with Care, and the volume of activities during that week has increased for this global multi-year campaign. Part of this campaign also involves education of healthcare workers on this issue. In 2017, 131 countries participated, and data from 2018 showed its strong engagement by countries from all 6 global regions, with almost 500 global events. But because tackling antimicrobial resistance has a multi-sectoral nature, the strategy would be to develop more specific activities like these and platforms to encourage and enhance civil society, private sector, and stakeholder engagement to their full participation. Initiative number 3 is to strengthen the knowledge and evidence base for surveillance and research. The WHO supports a standardized approach with the Global Antimicrobial Resistance Surveillance System, also known as GLASS, to collect, analyze, and share data related to antimicrobial resistance at a global level to inform decision-making as well as drive local, national, and regional action. The second annual GLASS report was issued in January 2019, and 57% increase was apparent in country enrollment in GLASS from 2017 to 2018, and almost twice the number of countries submitted antimicrobial resistance data. Progress in country participation is continued, and since 12 of February 2019, 73 countries are enrolled in GLASS. However, we have to ask ourselves, is this enough? Improvement of monitoring is very challenging, especially when trying to implement a framework that can be used across many sectors in low and middle income countries that is robust, with valid indicators, and that is also reliable, operational, affordable, and comparable. But the small size and relative isolation of the WHO Western Pacific region countries is an advantage. When it comes to monitoring antimicrobial consumption due to little parallel importing of medicines and easier national coverage of dispensaries. So the strategy here would be to reinforce the need for countries to be assisted in developing systems and processes needed to produce data consistently and support national and global monitoring. And with the use of our technology, clinics or regions with prescribing patterns that do not meet the standards could be audited and provided with targeted education if required. Initiative number 4 is the enforcement of preventative measures, sanitation, hygiene, and infection to reduce the incidence of infection. On the 5th of May 2019, WHO launched a campaign called Save Lives, Clean Your Hands. It provided a lot of support, more than 40 countries for the infection prevention and controlled by assessing and implementing of WASH, which is the water, sanitation, and hygiene, and improvement of healthcare equity in the context of universal health coverage, especially for countries in the West Pacific region. I would like to take your attention to this poster. During the outbreak of the COVID virus, we have seen that the continued reinforcement did not just highlight the importance of hand washing and sanitation, but it also increased the panic buying of all the antibacterial soaps and hand sanitizers. This shows us that in critical situations, this works all too well, and under normal conditions, this reinforcement technique should be tried to try and reduce antimicrobial resistance. And finally, initiative number 5 is to optimize the use of antimicrobial medicines in human and animal health. In 2017, WHO adopted a new classification for antibiotics and introduced the AWARE framework to guide their optimal use and reduce resistance, consisting of 3 main points. Number 1 is the excess, states that antibiotics should be available, affordable, and quality assured at all times because Western Pacific region is currently experiencing more death due to inadequate access to antimicrobial drugs rather than antimicrobial resistance itself. Number 2 is the watch, which is the surveillance of antimicrobials under the highest priority because of their critical importance for human medicine and are recommended only for specific and limited infections. And the third point is the reserve point that considers situation when all alternative antibiotics have failed and an alternative required to treat infections and antimicrobial issues. On behalf of the Western Pacific region that is experiencing the greatest impact of antimicrobial resistance that is driven by the overuse and misuse, it's important for us to look at how we're responding and maintaining prescriptions to people, animal health, and how that is affecting the environment. The challenges of antimicrobial resistance are complex and multifaceted, but they are not impossible. By strengthening stronger technical support on the overall governance, putting greater investments, generating relevant research, asking member states to contribute to GLASS, and willing to strengthen protocol and surveillance in the context of pandemic outbreak could be seen as part of country's pandemic approach. And by implementing these proposed recommendations will help to save millions of lives, preserve antimicrobials and generations to come, and secure the future from drug-resistant diseases. Let's make this a priority this time around. It would be odd not to consider this issue in the light of the COVID, where member states will and currently are in need of additional support during our current microbial pandemic. Antimicrobial resistance is a persistent global health change and needs to be represented at the global stage, and there is no time to wait. Thank you.